Well, as vaccinated Sydneysiders begin enjoying new freedoms this week, one group of Australian scientists is warning New South Wales' roadmap to opening the state back up will result in overcrowded hospital ICUs and as many as 1,000 additional COVID-19 deaths.
The new modelling has just been released by the OzSAGE group, and leading epidemiologist Raina Macintyre is a member of that group. She joins us now from Sydney. Professor Macintyre, good morning to you. This modelling has the stress on Sydney's ICU system peaking around Christmas, New Year's. Why is that?
Good morning, Michael. First of all, I'd just like to clarify that the modelling is from my research group. There's lots of other modellers in OzSAGE and they're doing their own modelling. Basically at the moment, the situation in Sydney is that with partial restrictions that have been in place since June, it is controlling it in the sense that we haven't, gone into really, astronomical case numbers, but it's not enough, right? So we're still seeing a rise in cases. If you release restrictions, which essentially means more people moving around and mixing, you'll see another surge in cases. That's just the way the virus works. It wants to spread from person to person. The more opportunities you give it to do that, the more it's going to spread. And I think we should think about those targets in terms of the whole population vaccination rate. So 70% of adults or 16 plus equates to about 56% of the whole population. And then the 80% target corresponds to about 64% of the whole population. And we've seen Singapore still struggling with Delta when they've got over 80% of the whole population vaccinated. We've seen what happened in Israel and the US when they released restrictions, when they achieved about the target that we're aiming for with the 80% of adults vaccinated. So we can look at what's happened in other countries. Essentially, you need to really ramp up all your other measures. If you're going to be relaxing restrictions, vaccine alone is not enough. You need, vaccine plus. The masks are really important. The contact tracing and the testing is really important. Our model estimated that the ability to rapidly trace contacts really dropped off after about the middle of August when case numbers got too big. If you can't trace the contacts and quarantine them, that's the next group of people who are going to be getting infected. So along with releasing restrictions, we need a whole lot of other measures to really mitigate that spread that will happen. It's quite predictable. You relax restrictions and more people are moving around and mixing after the middle of October or so, you will see another surge in cases.
If things get really bad, though, and there is that much stress on the health system, and New South Wales is quite intent on coming out, certainly at 80% double dose for adults, do you see no other choice, along with those vaccine plus measures, no other choice but to go back into lockdown to bring those cases down?
Well, that's what we've seen around the world. When things get out of control and the hospital system is under threat, that's usually the point where going back to lockdown is required. We don't want to be in lockdown, but I think there's a lot more that can be done. It's like tweaking different parts of there are lots of things that influence how fast the epidemic will grow. So you can relax restrictions, but you need to make sure all your other pieces are maximised. So I would recommend not dropping the outdoor mask mandate. Keep the mask mandates. You can still go around and do what you want to do with the mask on. They really do work. There's a lot of good evidence around the world. We need to really ramp up the contact tracing ability because we estimate it's not happening rapidly enough. And that means using digital technology. A lot of Asian countries have done that. We need to make sure the testing does not drop off as case numbers rise because you have to be able to identify new cases. So all that's happening around approval of rapid antigen tests, etc., is all good. The more accessible testing is, the more the average person out there can go and get a test and test themselves even, the easier it's going to be to control things.
OK, now let's finish up with the present day. Do you see any signs as we stand this morning, Raina, of the curve in Sydney beginning to flatten at all?
Well, nothing's changed in the restrictions, right? We've had the same restrictions essentially since August, and that hasn't flattened the curve. The numbers have gradually kept increasing. The problem is the virus doesn't recognise geographic boundaries. It's going to spread, when there's mixing of people, whether it's people working in different areas. So our model estimates there'll still be numbers in the high thousands by the middle of October at the time we're releasing restrictions. And that really will determine how much of an upsurge we'll see after releasing restrictions. So it's really important the numbers go right down. The Doherty model, for example, assumed there'd be 30 cases a day at the time you relax restrictions, and clearly we're nowhere near that.
Some sobering modelling, some sobering thoughts there. Professor Raina Macintyre, thanks for joining us on News Breakfast this morning.
It's a pleasure.